Hi, Anthony. Thank you so much for agreeing to meet with me today. Ash is really excited to launch our new report on ways the tobacco industry is interfering in the US. And as a part of our release, we want to talk with experts like yourself to get your take on the actions of the tobacco industry. So, Anthony, you are the director of Tobacco Free Western New York at Roswell Park Cancer Institute, Department of Health Behavior. And your work has made a tremendous impact on the Western New York community. Can you tell us about some of the impact of tobacco-related policies in New York?
Absolutely. It's certainly a team effort of which I'm just a part. And I would really say that the soldiers in the war against tobacco, the boots on the ground, are probably the most effective in the significant turnaround that we've seen from the beginning days of the first Surgeon General's report in the 60s, where the United States tobacco use rate was close to 50%. And the national rate, as is New York State's, is down, hovering right around 14 and dropping continually year after year. And the work that goes into that is that we are the lowest in the lowest group of 10 states in the United States. Things that we've accomplished along the way is that we have, if not, I think we're the second highest tax in the United States for cigarettes, which we know is a lockstep way to drive down tobacco use. We recently raised the age of purchase to 21, which a number of other states have done, but not lots. We have um, um, countless tobacco-free. We have the Clean Indoor Air Act, of which some states have done, but the numbers haven't. But we were among the first in 2003 to do that. And just recently, we banned all flavors except tobacco flavor in all vaping products. We banned the sale of tobacco in all pharmacies. And we are working on a bill in the state government right now to go further and get close to what Massachusetts did, which is ban the flavors in all products, including combustibles and chews and everything else. So any tobacco product would only be sold with the tobacco flavor. So these are all steps in the right direction, and every time we've taken a step, we've driven the use down.
That's great. New York has made quite a few advancements. Uh, so, have you seen any egregious tobacco industry interference when you've been studying some of the policies and changes that you've made in New York?
Yeah, of course. I know that Chris and I are working on the Project Sunset, and we've been eagerly talking about the changes that have been going on in California. And we noticed that the tobacco company went out in force when the state decided to ban all flavors. And immediately they mobilized a deceptive campaign and generated 1 million signatures to create a referendum, which we know will be voted down. But it's a known tactic for tobacco, is that they're not so interested in wins as they are. They consider a delay a win, because they're really, all they're in the business is to generate a profit. And tobacco products are among the most profitable in the world. And if you follow the stock market, you'll constantly see tobacco businesses as a continual buy choice, because it's they're printing money, and that's kind of sad. But locally and in New York State, I could go back to 2010 when the Family Smoking Prevention Act went into effect, and it gave localities the opportunity to regulate the time and place and method of tobacco sales. And under the work of Mike Cummings, we were actually actively working with the city of Buffalo to create the Responsible Retailers Act. And we worked behind the scenes and put together a fairly robust bill that would ban the display of tobacco products, among other things, in the city of Buffalo. And the moment that the bill surfaced in the Common Council, tobacco industry reps were lobbying through local representatives. They were visiting the council member who was taking the lead sponsorship on this. They were visiting the mayor, and they were talking about the negative effect of the businesses in the community and everything like that, and all sorts of deception. And the bill quietly died away. And less quietly was a few years ago when a small village on the Hudson River known as Haverstraw decided to ban. I think they also went into a display ban, and within a day of the bill being announced, 5 tobacco companies and 1 retailer. There was only like 7, I think, less than 25 retailers in the town. And with that level of impact, they knew the public effect of having one, like a sort of a domino. 5 tobacco retailers and 5 tobacco companies and 1 retailer descended on this tiny town and said, "Here we are, folks, and we are going to compel you to quash this bill, or you will be on the hook for all legal fees of our 5 tobacco companies and this merchant." And this is this tiny town that, had budgets probably in the small millions, if even that. So they backed away very quickly. So big tobacco uses numerous tactics that we may talk about today, but they're not friendly. They're not to be trusted, and all they care about is the bottom line profit.
Yeah, it's very unfortunate. So, based on your experience, what message would you have for policymakers, advocates, and the general public when it comes to combating tobacco industry interference so we can strengthen our collective public health?
Um, the clearest outcome of our work is that our tobacco control efforts saves money and saves lives. We know nationally nearly 500,000 people die in the U.S. due to tobacco use. In New York State, it's between 25 and 30,000 people, human beings, are dying from a product that is sold legally. There's no safe level of tobacco use. The other point is that we know that in Medicare and health dollars and time lost, we lose about close to $10 billion a year in New York State. And that tobacco spends billions nationally each year to assure that their products are visible, even though there's been a near complete ban on traditional advertising. They own the front counters of every store, and there's hundreds of thousands of retail outlets. There's something like 17,000 retail outlets in New York State alone. There's one would wonder why. Why is it? And the only point is that so that there's visibility for young people to see it and feel like there's some normalcy about it, and availability so that anybody that's thinking about needing a cigarette know that they don't have to go very far to get it, because even those that quit say that seeing a cigarette is a trigger to make them want to go back to smoking. And you can bet on it. We've seen eye tracking studies that we do right here at Roswell that people cannot look away from that wall of tobacco behind the counter in every cash register stop you make in all the stores. And thank goodness we took them out of pharmacies, at least in New York State. We can only hope that they would go nationally. I mean, why would you have a product that kills people at the front counter when the medication they sell it is happening at the prescription counter? So, that's one message. And the other important point is that our tobacco companies would love to see our work go away. But without our steady education, advocacy, and community level policy change, we would not have this broader statewide and national awareness that our program brings each day. When local and state programs are cut back, we've seen the use of tobacco start to creep back up. And that's what's most important, is that our steady drumbeat and our steady boots in the ground, hammering the message so that we're sitting in community health meetings, assuring that we're on their CHIPS agenda of the community health improvement programs, that tobacco is not forgotten. Haven't we solved that problem yet? People ask us that one. Well, no, we know, you and I know, Chris knows, um, the battle is long from over. And where it might cost $50 to treat someone using nicotine replacement, it costs $50,000 to bring someone into a bed at Roswell to treat them for lung cancer. And tobacco-related diseases take up a third of our beds.
Those are very important points, Anthony. Is there anything else you would want to share about the tobacco industry and their interference in public health policy?
Yeah. Funny you should ask. Big Tobacco has hidden behind community sponsorships of education, sports, arts, entertainment, even nightclub events, so that they could find their way into college kids and LGBTQ plus communities, African American communities, underserved communities, undersupported communities. We know that outdoor advertising of tobacco on storefronts and bodegas happens much more in our poorest neighborhoods. Even the worst of it is the junk science that they put out, that they mask themselves behind these quote unquote foundations, these research institutes, to sort of match the bona fide research that happens among scientists like Dr. Hyland here at Roswell, and Dr. Cummings, and Jeff Fong, and Tom Novotny, and all these scientists in America and across the world that are bringing the real story of what this problem really is. And now you see that we're getting into this being a human rights issue, a social justice issue. And the tobacco companies are doing everything they can to push against this argument. The bottom line is, we know that there's absolutely no safe way to use combustible tobacco products. And until the tobacco companies have products that equal the financial return of their cigarettes, little, if any, statement they make from toward us can be trusted.
Absolutely. Well, thank you so much for joining us today, Anthony. We really appreciate your continued partnership in the fight to end the tobacco epidemic.
I'm glad to be joined with you guys. We're on an exciting quest with Project Sunset, and I think the best tobacco control begins locally, and then we can make it national and make it a worldwide quest, and get us all fighting on a daily basis. Glad to be here.
Yes, definitely. Thank you.
Take care.